like Megan was saying, there's a plus and a minus to everything. It's like structure is my friend, but it also is my downfall.
The only struggle that I have is that, and it kind of ties into what we were talking about, is the every 2 weeks, new
Oh,
people,
yeah.
places, things, and
Yeah.
routines. When we're not practicing social skills and we're
Mm.
not engaging in masking and mimicry of social behavior, people tend to have negative reactions. They sense that something is off and not right, but they don't know sometimes what it is
What it
that's
is.
wrong with you, and it gives them a they don't like it.
What advice would you give to an autistic person considering a career in veterinary medicine?
I will caveat my answer by saying anyone who asks me about a career in veterinary medicine, I try to poke holes in.
Welcome to the On Air podcast. This podcast is a program of the American Association of Veterinary Medical Colleges Diversity Matters Initiative. The podcast explores various issues related to diversity and inclusion in the veterinary profession and provides the AAVMC an opportunity to offer ongoing diversity programming to our member institutions and to all veterinary professionals. My name is Dr. Lisa Greenhill, and I am the Chief Organizational Health Officer here at the AAVMC. So on today's episode of the show, we are exploring the lived experiences of students, professionals with autism. Given all of the recent public discourse in the US anyway, about autism, and who knows, we might talk about that just a little bit. I think it's really important that we do some level setting with actual data and definitions and those types of things. So autism, or Autism Spectrum Disorder, ASD, refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. According to the Centers for Disease Control and Prevention, autism affects an estimated 1 in 31 children in the US and 1 in 45 adults. Boys and men are 4 times more likely to be diagnosed, and it does tend to manifest differently across the gender spectrum, with girls and women tending to have different kinds of symptoms, sometimes a little bit more subtle symptoms, which often can lead to misdiagnosis or no diagnosis at all. As I mentioned earlier, this is a spectrum disorder. It is a lifetime lived experience. And so there are folks, again, on the spectrum, there are some folks with what are considered profound symptoms. Those are about 1 in 4. Those typically are identified in childhood. And then the CDC also reports that as many as 50%, about as much as 50% are considered high functioning. We can talk a little bit about what that means as well, the difference between kind of profound versus high functioning. Again, very broad terms. But like other forms of neurodiversity that we're seeing kind of become maybe not as visible, but certainly more vocal in the veterinary profession. Individuals with autism are increasingly visible. We're seeing folks, we're hearing about folks. They are in our colleges of veterinary medicine. They're out in practice, they're techs, they're clients. This is a lived experience for a lot of folks in the profession. And so with that, I am very, very excited to welcome my guest today, Megan Gauthier. Did I get it right? Awesome. And Frank DeCecco. Okay, great. I am like all about phonetic writing right now, so I'm trying to be better. So with that, as is our custom on this show, I've asked my guests to spend about 2 minutes or so giving us a little bit of background about their journey in veterinary medicine with autism. So Megan, we are going to start with you.
Okay, yes. So my name is Megan Gauthier. I'm a fourth year veterinary student at Oklahoma State University. And my journey with autism and veterinary medicine are incredibly enmeshed. You talked about females often being misdiagnosed, which was my experience as a child. I was institutionalized in and out of institutions and facilities and programs and special schools. And I was medicated and tested, but not for autism spectrum disorder. It was traumatizing. And sorry,
Okay.
um,
All right. Take a moment.
many terrible things occurred in these facilities, and it was traumatizing as a whole. As a young adult, as soon as I turn 18, they cannot hold you against your will in these facilities anymore. I stayed as far away as I could and decided um, I need to make my own life and do it on my own. I'm going to achieve my dreams on my own, and that's
Okay.
okay.
You're doing great.
Okay, so I decided I need to make my own life for my own, and I struggled a lot, obviously, early starting out, early adulthood and starting out. I also had other trials and tribulations. However, I was a vet tech for about 10 years, and in 2022, I applied and was admitted to veterinary school, and been having a fantastic time living my dream. And I guess that's the short of it. Yeah.
Awesome. Awesome. I can't wait to dig in more with you and hear more about your story. So, Frank, tell us a little bit about your journey.
My name is Frank DeCecco. I am a 2008 grad of Colorado State. So this would be my 18th year of practice. And boy, does that sound old when I say it. When I was growing up, I definitely had a place where I felt very different from those around me. Um, at the time, I was in middle school and junior high and high school. The buckets you could be in, as a personality was introverted or extroverted. We didn't have these
Mm,
kind of conversations. We didn't talk about neurodiversity. We didn't talk about ADHD, autism. We didn't talk about any of these things in the way we do today, which is so amazing that we've come to where we are. But you were introverted or I was introverted because when I tried to interact with the world, I kept getting hurt.
mm,
I didn't understand how to make friends. I didn't understand how to have interpersonal communications. So I said, I'll just withdraw and I will just do things internally. I had very strong sensory reactions to light and sound and some other things that could have been picked up on earlier in the game if we were looking for those things. But I think that just being a adult kind of working their way into the world through my high school and original undergrad experience, I learned to mask a lot. I learned to try to fit in a lot, which is exhausting,
yeah.
as we know. And I found that I have about a teaspoon of executive function per day. And if I use that in just trying to blend and trying to make it look like I'm everybody else, I have very little to be productive. And as time went on in vet school, things got worse and worse as far as trying to sort out what's going on. Do you have anxiety? Are you depressed? Those things are certainly present as well. I don't want to say they're not. I definitely have anxiety disorder, and I definitely am on some good medications that help me with that. But overarching all of this is the way I interact with the world and the way I use my energy differently than other people might need to. Neurotypical people might need to do things very differently and have much more brain space to kind of interact and do things like that. So being in a profession like vet med that is so heavily in conversation and in consultation, oh boy, did I have to find some strategies, out in the workplace to do that. And I'm still learning how to do it. I still make mistakes with it. But I found that overall we have become a more tolerant and a more understanding group as knowledge has increased for the most part. Not in all areas of our society necessarily, but certainly within, I think, the majority of vet med, because we do have, I don't have any numbers to back this up, just my personal experience, far greater ratio of neurodivergent people within our profession than the general population. I think we attract certain types of people. I think vet school admissions is also a piece of that funnel.
Sure.
And so, getting to understand how we interact and how that works for us is super important. So thank you for allowing me to be on.
Sure, sure. Yeah. I would definitely say in the last 10 years in my role at AAVMC, I'm a researcher, but anecdotal data is still data. And it just seems like a lot more folks, maybe more late diagnoses, just more recognition, certainly with the entire kind of collection of neurodiverse conditions, we're just seeing a lot more. And of course, typically, as we said on a previous show on ADHD, usually these things run in packs or pairs. You don't just have one. you, you get blessed with a couple. And so, there's a bit more visibility with folks kind of talking about it. So, Megan, our next question is, how for you do you think autism affects the way that you see the world, and how does that impact the way that you've approached vet school?
So it's
Give us about 3 minutes.
Sure. So it's difficult for me to say how autism impacts the way I see the world, because I don't have anything to compare this to. However, I know that typically I have, since it's developmental disorder, I have kind of an immature, I've been told, immature and naive, blissfully optimistic view of the world and everyone and everything in general. So I think that is definitely related, like the unrelenting positivity, and it tends to be related, probably attributed to the autism. And so I forget what the other question was. I'm sorry. Talk
Sure.
about.
How do you think that impacts, your approach at vet school?
So there's that in general. Now the deficit side of it is emotional regulate, and what I tend to struggle with in veterinary school. So with the positivity, I tend to just look at everything as, I'm so excited to be here. I'm so excited to learn. I could read about and talk about vet med, all things, all day. So I'm just happy every single morning I wake up. I'm so just glad, and like, of course I get stress, but
Sure.
like, yeah, so happy. The downside of that is like the not being able to identify, communicate or process emotions are difficult, and so and veterinary school is incredibly and intensely emotional. And so I just approach that at it's just coming from a place of knowing that I struggle in these areas, ensuring that I have multimodal support, and that it's a daily, sometimes hourly, commitment to maintaining mental health, and just doing the best that I can every day, and just being able to communicate with professors and everyone I'm working closely with, making them aware that have this disability, and these are the things that are helpful. I've got it down to where, I don't really think about it much on a day-to-day basis, to be honest, anymore. Yes.
I have to say, I am somewhat jealous of waking up every morning, that you're waking up every morning with that much optimism. If you can ship that to me, I'd really appreciate a bucket of it. Because I recognize that for some people, it's like, wow, Megan is always up. And, sometimes that's challenging for folks that don't wake up. But I'm somewhat jealous. So Frank, how about you? How do you think is really kind of, again, recognizing that you don't really have a lot to compare it to, but in your observations of being with, other people, neurotypical folks, as well as some other neurodiverse folks, how do you think it's all shaped your approach as a veterinarian?
Yeah, I tell you, starting with vet school. Like, I realized that I have a couple of facets that are kind of constant with me. One is I like structure,
Mm,
and I like having a pattern to follow, and I'm also completely disorganized at the same time. So if I don't have that structure or pattern, I am just Mercury on the floor running around. And I realized early on in vet school that I needed to get with people who had study skills and organizational skills, because I never knew how to study. I just kind of went through my classes, and by whatever, was able to kind of do well in undergrad and pre-vet. Getting the grades necessary. There's a goal. I can meet a goal. I need to get these kind of marks in these kind of advanced science courses. Okay, I'll figure it out. But I had to start asking for help, which was super hard for me, being a loner and not knowing how to even really have those kind of interactions, but to get into study groups and to do things like that. So vital for me getting admitted in the first place, and then keeping my head above water while in the PVM program. But like Megan was saying, there's a plus and a minus to everything. It's like structure is my friend, but it also is my downfall. Example, first year, we spent all first year basically in the same classroom all day, and the professors just kind of cycled through as they do. And we had like a 10-minute break between each period. And for me, that means that 10 minutes is Frank time, that I get to do the things I need to do to get ready for the next class mentally, just to be able to prepare my thinking or whatever the case might be, or go to the bathroom, whatever. And so we had one instructor who was kind of chronically going over the time, like 2, 3, 4, 5 minutes, which sounds like nothing. But again, you're in Frank time now. So like the third time they did it, I just got up and walked out of class because I had to go to the bathroom. It was like I was not trying to cause a scene. I was not trying to make a statement. This was not anything of a form of protest. It was just like, I've got Frank stuff I've got to take care of, and this is my block of time to do that. And so I did. And then the next class, they called me out on it. The professor was like, that was very disrespectful and rude to get up when I was talking and walk out. And boy, I did not handle that criticism well, I'll tell you what. But just learning how to operate within the system of academia was a really good set of experiences to go on and then be in practice, because they're all going to be their own tiny versions of that. All the kind of things you run into on the clinical floor in vet school is going to be manifest out in your first opinion practices or wherever you end up, as far as that goes. So yeah, I mean, I think it's a balancing the pluses and minuses, and knowing when you've done something socially inappropriate and being able to say, hey, it was not intended to be about you. This is my stuff, and I've got to do the things that my mind tells me.
Yeah, your mind and your body, right? Megan, I see you reacting. So I'm guessing that you can relate to Frank time. You have Megan time. And that, hello, those professors who might run over a few minutes and not necessarily think it's a big deal. For some folks, that's a huge deal. It is. I mean, anybody who's been in a class with faculty who run over, and it does happen. I'm not saying, it doesn't happen, but just know that it does tend to get a reaction, certainly from folks who are neurodiverse, where organization and time are so critical, but it's also really annoying to normies too. just to be clear. So, Megan, what are you, fourth year? I can't remember if you addressed that in the top of the show.
Yes, I'm in my fourth year. Yep.
So, being in clinics is a very different kind of experience, and things are moving, and critters are all around, and people. And so how's that experience going for you? And what are some strengths that you've actually discovered along the way during this year?
Yes, I'm having a blast overall. I am getting and receiving nothing but positive feedback on we have a feedback system. I'm having an absolute blast. I'm so glad to be I loved the academic. If you ask me about how I felt about the first 3 years, I'd say the same thing. But yes, so moving on. Yes, I'm having a blast. Some of the strengths that I'm realizing because I had so much. I say that basically I grew up in animal hospitals. I was working in kennels when I was in high school, straight into clinics and working my way up to, I was a technician for so long, and I learned my best way to socialize and interact and with people was in veterinary schools, or veterinary clinics, and in a veterinary setting with clients and with coworkers. That's some of my strongest communication. And I think it's because I just love it so much, and I just care about it so much that it was worth the effort to learn, because it meant so much to make that work for me and for other, to make it work for myself
Yeah.
and for others. So those definitely demonstrate strengths as far as just feeling comfortable and confident working through cases, and patient handling and clinical skills. And so I think, yes, I think those are just having a great time. And those are some of my demonstrated strengths.
Great. I love that, you've kind of had this opportunity to take all of those lessons beforehand and really kind of channel them. You say that you've enjoyed the entire program. I'm sure your dean is loving this. Number one. Number two, are you having more fun now that you're in clinics versus kind of butt in seat for 3 years?
Ooh, that's a hard comparison, because like I said, I had so much
They're
fun
so
in
different.
both.
Yeah.
And they're so different. Yes, this
Yeah.
is such a different comparison. I think so. I think so. I think I'm having a better time. Again, I'm like, I love all of it. I loved all of it. But I think I'm just having a better time because I'm getting closer and closer to what it is that I'm actually going
Yeah.
to be doing. And like you said, combining all of the skills all together. I do definitely, the only struggle that I have is that, and it kind of ties into what we were talking about, is the every 2 weeks, new
Oh,
people,
yeah.
places, things, and
Yeah.
routines.
Yeah.
So it's I get the routine down, and then it's changes again. Yes.
Yeah. 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 So, Frank, how about you? What are some strengths that you believe? What are your autism superpowers, if you will, that you've
Um,
learned along the way?
yeah, I mean, certainly, I have a ability to focus and find details. Be able to see little changes, little asymmetries, um, uh, lamenesses that are so
Mm,
subtle.
mm,
I just have kind of a tunnel vision on patients in that way. Interacting with animals is much different than how I interact with people. I don't feel pressured to have verbal conversations. Even though I do talk
sure.
to my patients, I do.
Sure.
I get all stupid. And, oh, look how cute you are. But at the same time, it's much more of a body language thing that I feel much better about than trying to understand tone and other
Yeah.
certain things that can be hidden in language. Just to touch on Megan's point, it was clinical year for me when things fell apart and I
Mm,
realized the diagnosis for what it was, and I couldn't hide it
mm,
anymore because I was thrust into positions that were just overwhelming and overstimulating, and it all came to a head when I was doing 2 weeks of overnight in the ER,
wow.
and I flamed out. I
Sure.
verbally said something to a classmate that was totally rude and uncalled for. Like, I was overstressed, and it just came out sideways. Something that would never occur to me to do or say. I said, and so yeah, I was actually I had to do some kind of remedial work around that. There was definitely some, write an
Hmm.
essay about learning your lesson about this particular thing, kind of thing. And
Yeah.
it was very, I don't remember the specifics, honestly. I buried that apparently, but I do remember there being an incident where I totally had an emotional outburst, which was not something that was in my history, but the lights and the sounds and the smells
Yeah.
and the lack of sleep and the flipping your schedule around and all those things. It was like I was set up for disaster and I didn't even know it
Wow.
going in there. And it didn't take long for me to bust and be like, this is, I don't know what I'm doing. And then of course the self-doubt about, okay, well, I thought you were going to be a doctor. You can't handle these things. What are you even doing now? So a lot of internalization of fears and anxieties about being able to translate intellectual knowledge, book knowledge, into actually caring for patients, because you've got to be in the environment, you've got to be on the clinic floor to do these things. So you've got to deal with all those other pieces of it.
Yeah.
And so that was a big learning curve for me, just even beyond all the technical skills and everything else. It was I have to mentally focus on keeping my emotions in check in a way I never had before, because I never really had those. I never had an emotional geyser of feelings about anything at any point. I was a very monotone emotional person for most of my life, up until I got put in these highly stressful situations, and it just came out sideways, and I hated it. I hated myself. I hated how I was acting, but I didn't, even at that time, I did not really understand how the spectrum disorder was affecting me, and how it was my brain chemistry and the whole thing. So it was very much a learning experience in a lot of ways. But yeah, clinical year was very rough for that reason, in addition to all the other ones that you normally expect.
Sure. So I'm curious, Frank, staying with you for just a moment, what have you found in terms of tools or strategies, accommodations over the years that have really helped you thrive? What has really kind of, you talked a little bit about how particularly some of the unique stressors of the clinical year kind of set you up badly for some experiences that year, but are there things that maybe along the way, accommodation strategies that you learn? Certainly, gravitating to the study folks is certainly one of them.
Yeah, no, for sure. I can tell you the bottom line up front is that working for myself, I primarily do relief part-time now, is my answer. I have tried many things along the way. A really brief review of my CV. I came out of vet school. I did 10 years active duty in the Army Veterinary Corps, and as physically, mentally, emotionally challenging and bad for me as that whole situation was. You want structure? They've got that. You will know where to be and what to wear every day of your life. And so I did that. I got out. I did a specialty internship. Having a very considerate, caring individual as a mentor helped me tremendously during that time. That I could be totally honest with. That I could say, hey, here's where I'm having a problem with XYZ, and not just this endocrine disease, but also what I'm thinking about. And I've tried various different job options through the remaining years of my practice, and there's just what I found is, unfortunately, in my experience, asking for accommodations is never well received for me. I've found that it tends to backfire. It tends to be used against me in certain ways. Even I'm hoping. My hope is that as people and I'm solidly Gen X, as you can kind of tell, but as people of my generation and after come into practice ownership and practice leadership, I am hoping that will change from the prior generation and the way that they kind of look at the business of vet med and running a hospital and all of that. I certainly, that's kind of why I want to do this. That's kind of why I spend a lot of my time on the LinkedIn, which I call it specifically the LinkedIn, just
the LinkedIn.
that's what you do when you're old. Just promoting neurodiversity and promoting underrepresented and under-recognized groups that don't have the ability to platform. I think that there's very little that's special about me, and just by fate of birth or whatever, I have this. I present cis het white male, all those things, and all those things are true.
Yeah.
But that doesn't mean that I am part of the establishment or want to be. But I think that I have the ability to use my voice in a certain way that might get more people who look like me to listen than perhaps other people. So I think contributing in that way is part of what I can do to make things better.
Great. Thank you so much. So, Megan, what do you have accommodations at Oklahoma State, and what have you found to be the most helpful? And
Yes. So first to validate Frank as well in saying yes, I'm having such a great time and everything is so fantastic, and including I have well, no, I mean, like, not to engage in hyperbole, but near meltdown nearly every rotation. So I get to that point nearly
sure.
once every rotation, but because of the formal accommodations and ways that I've found to help myself and communicate those needs, I don't have to injure myself. I don't have to injure others. I don't have to engage in antisocial behaviors anymore. And so what these accommodate what for me for accommodations, fortunately I don't run into accommodations not being respected because these are protected by federal law. And so at Oklahoma State, my accommodations are respected, as well as there's a clause for general accommodations. So I definitely, of course, get testing accommodations, which is
Sure.
time and a half, headphones, separate spaces, those kinds of things, as well as general accommodations, which, and for example, mom's shelter medicine. We spay and neuter, and it's high volume, it's fast pace, and actually I had a full meltdown, I'll say, on that one. I had to make some phone calls.
Okay. So great.
And then I talked to my professor afterwards, and she was extremely, because I had communicated and sent in the paperwork and talked about, so she knew I was a student with a disability, and she comes up to me, and we talk about, how can we help? How can we make this better? And we come up with, that I can be at the surgery table only facing the wall. I can wear one earphone, not earphone, but earplug, just
Yeah.
silence in one of my ears to mitigate the noise. And like even keeping the back of my doing the open back gowns
Mm.
for just the heat and
Yeah.
all that, and
Yeah.
accommodations like that. Yeah, yeah.
Yeah.
So
Yeah.
yeah.
Yeah. Yeah. Very helpful. And it's really great when you actually have accommodations that are respected, and that, not just because you're federally entitled to them, but because people genuinely care, right? It makes it a lot easier, I imagine, right? And so, so it does sound, though, like, certainly for you, Frank, that there have been these moments of ableism, and or at least just kind of misunderstanding about your experience and kind of how you move through the world, right? So I'm kind of curious if you could talk a little bit about that. Certainly you talked about colleagues maybe not giving and not respecting accommodations, or those kind of not being received well, but have you had any other experiences? Of course, I do not want anyone to relive awful things that you don't want to remember or talk about. So feel free to tell me to shove it.
Yeah, I mean, I guess, again, it's only my experiences and with a couple of individuals, in the profession, but, I was working at an ER, and I was working 12-hour shifts. And because of the way life is, that means 14 or 15 hours once you're
Mm.
done with records and patient care and what have you. So after trying to do that and trying to stick it out and trying to just be a good team player and all those things, I went to my supervisor. I said, look, I literally, I can see after 10 hours I just fall off a cliff. That's the most I can focus. That's the most
Mm.
I can have my doctor brain working. And after that, my care is not as good. My thinking is not as good. My decision making sucks. My interpersonal stuff is I can't control it anymore. Really,
Yeah.
I can't act like you expect me to act with staff or with clients. So I though 10 hours would be fantastic. Now, of course, when you've got a busy ER practice and trying to build a schedule, I can see both sides. It's like trying to have one doc who's doing 10-hour blocks and everybody else is doing 12s. How do you cover that
Yeah.
time? And they thought a good accommodation would be, instead of scheduling me for 12, schedule me for 11 at a time. And I was like, well, I appreciate what you're trying to do. I'm still in that bucket at the end.
Yeah.
I remember I had a conversation actually recently at a practice where I felt like I was being called out for not being able to do something. I was pretty much constantly being ridden about a particular skill that I was not meeting their expectations on. And and what it boiled down to was is like, I don't feel psychologically safe here. I don't feel like I
Mm.
can
Mm.
fail in this environment that you've created, in this culture. And the medical director looked me in the face and said, "You're safe." Not the right answer. When someone tells you they don't feel psychologically safe, that's where you've got to start. You know what I mean? That
Yeah.
is the
Yeah.
reality for the person across the table from you.
Yeah.
And and just say, oh, that's not true. You're not. No, you're fine. So even and this person is a well-meaning, very smart
Sure.
person,
Sure.
very good clinician, very sweet individual outside of work. I think if we had met under different circumstances, we'd probably be good friends. But just in that moment in the work environment, I just lost all respect, went out the window. I was like,
Yeah.
what am I have to convince you now of this thing? And so, yeah, I mean, I think that, for me, if my ability to hide a lot of my disorder works against me because, you know, you seem pretty normo,
Yeah.
why can't you do this other thing that everybody else can do? It's like, well, no, because I'm using 99% of my energy to do all this stuff that to you is, you fall out of bed and do it. I've got
Yeah.
to prep, and I've got to prepare conversations, and I've got to
Mhm.
build up energy to make a phone call, and I've got to do all these things that is not the same for everybody else. And so, yeah,
Mm.
no, I don't have the same ability to do the things that you might expect, because a lot of my time and energy is sucked up just meeting what you call the
Yeah.
baseline.
Yeah. Thank you for that. And Megan, so, you had this, what sounds like a really pretty traumatic experience before 18. And it sounds like kind of things have, the lived experience sounds pretty radically different now. But what do the hard times look like for you?
Currently,
Yeah.
currently, what currently the hard times. I have to think about this. We should
Okay.
pause for 1 second. I have to think about
Sure.
this.
No worries.
I think maybe if the question's a little more specific.
Sure.
Okay.
Sure. So what are things that you are struggling with other people right now, right?
Okay.
Especially in clinics. So we know that things like you mentioned that kind of the switching every 2 weeks is pretty disruptive. And you kind of, you also mentioned that there are times in the middle that you have a near meltdown or meltdown. And just to normalize meltdowns, my wonderful colleague who's off in the background can tell you I melt down every week, like every week. Okay. I just want to normalize
Okay.
emotional reaction here. But how do your student colleagues engage you?
So yeah, I think it's hard. Yes, it's hard for me to draw up
Sure.
negative times, because even when things are hard, they're still good. And so I think for me to touch on and kind of drawing on
Sure.
childhood experience and early adulthood experiences that people have when we're not practicing social skills and we're
Mm.
not engaging in masking and mimicry of
Wow.
social behavior. People tend to have negative reactions. They sense that something is off, and not right.
Yeah.
But they don't know sometimes what it is
What it
that's
is.
wrong with you, and it gives them they don't like it. People don't like it.
Mhm.
And so that's why for me communicating, if hey, if you think something's off, you are correct, and this is what it is, so no problem. So drawing that into today, I don't tend to engage behind the scenes in tons of masking and mimicking behavior because we talked about how labor and energy intensive that can be. And so I save that for client facing social interactions. And so I think that's why sometimes the incidence of negative emotional reactions from me is increased because
Mm.
I'm
Yeah.
not trying to shove that down and things like that the way that I used to, because it will come out as an outburst and it's
Sure.
worse. So yeah, so for me what it looks like and it's always again like behind the scenes, for me it's just that I get overwhelmed, I breathe very heavily,
Mm.
I start hyperventilating. And at that point for me, when I start to feel that my thoughts are no longer linear and rational, I start to think something, I am emotionally dysregulated. And at that point, if I'm able to communicate, if I'm able to verbalize, that's the best. If I can just tell the person I'm having a hard time, but sometimes for me
Sure.
or other people, I can't verbalize what's going on. And at that point, I become extremely high risk for self-injurious behavior.
Mm.
And so I need to step away.
Step away.
I need to go into the hallway or somewhere there's no people, preferably outside. I need to relax. I need to gather thoughts, use coping skills, and then come back and verbalize what initiated this, and we
Yeah.
can come up with a solution. So for me, it's nothing groundbreaking and catastrophic and traumatic in the way that it used to be. Now I
Sure.
say, I can
Yeah.
recognize I'm dysregulated, and I can go and fix it and come back
Yeah.
and not feel bad about myself, because it's okay. It's not my fault. It's no one else. I don't have to be negative about anyone else. It's not their fault. It's not my
Yeah.
fault. I just felt bad, and we solved it, and nobody got hurt, and we're
Yes.
good. So
Yes. So after this, I might have to have you as my best friend because your positive outlook is just contagious, and I need more of that in my life. So, how do you, Megan, kind of practice some self-care outside of those individual kind of high stress moments? But how do you kind of, take care of yourself and manage your stress and kind of stay regulated?
yeah, so this is very important, and this goes to another aspect, that common theme with people on the autism spectrum is routine,
Yeah.
predictability, and self-care is one of my favorite parts of that routine. I love exercise, so I love to run, jog, that kind of thing. I love to go to the gym, work out, and I also love to do all kinds of physical activity. I play disc golf. This is like frisbee golf. When I lived in Florida, my favorite hobby was scuba diving. So part of self-care, engaging in physical
Yeah.
activity, and sports, and let's see what else. So also healthy diet. And then also I say my favorite saying is work hard, play hard. And so I also play video games and watch documentaries on Netflix and go to dinner with my neighbor Julie. And also, yeah, just general
Yeah.
hygiene and sleep. Go to bed at the same time, wake up at the same time. Very important.
Yeah.
And yeah, just yeah, work hard, play
Good.
hard. I like to make sure I have fun things planned, hiking,
Yeah.
little trips. Yeah, I like to do that. So yeah, yeah.
Awesome. Awesome. Frank, how are you regulating? How do you practice self-care and kind of self-regulation?
Not great at the moment, but in general, I definitely I second everything Megan said. Somewhere along the line, I heard move a muscle, change a thought, and being physically active and walking, and like you said, training at the gym, finding a sport or something that you have at least an interest in. You don't have to be good at it. It's like art. You don't have to be good at it. You just go and do it because you enjoy it. And having that system, having that program, having my bag packed the night before because it has to be ready to go, so I can just go without thinking about it. That's super important. And like she said, obviously, diet and sleep and those kinds of self-care, obviously very important. We know all about health, but yet
Yeah.
doing it ourselves, sometimes you walk into a hospital and the least healthy people you see are all the caregivers, around, because we are in a stressful environment and we don't always take care of ourselves. And it's easy to fall into habits that are not healthy. And we see that a lot. And so yeah, focusing on those things that kind of sound boring, but make me a lot more balanced, make me able to meet the challenges of the coming day, and be able to do what I can do to help the next patient. I think there's a need for me to be able to refill my glass so I can.
Yeah.
But you know what I'm saying is, you
Yeah.
can't pour from an empty jug.
Absolutely.
That's where I was trying to go with that.
Yeah.
But yeah, so taking the time, and it's not selfish. It's important. It's vital to be able to give back to yourself after you've been giving to everyone and everything else, and for us even more so, I think, because the slightest bit off can easily send me down a vortex. So
Yeah.
I need to do all I can to remain level.
Yeah. All right. So I have two questions left before we wrap up. So the first question, Megan, will go to you, and take about 2 minutes. What changes would you like to see in veterinary education or practice that would allow veterinary medicine to be more inclusive of neurodivergent professionals like yourself? If you had a magic wand, what is one or two things you would change?
I think I have one. I think
Okay.
maybe I have one thing.
Okay.
Because again, so I think I would just like. I think I would really like for the experience that I'm having to become the norm, so
Mhm.
that I would really like to see that people are receiving their accommodations, that they're being able to communicate, that they're not having resistance, or that it's not taboo, or you're not treated as inferior or less than, because you have a disability, and that it's not a difficult experience to receive accommodations, and those kinds of things. Like I'm thinking those are the things, like I have experienced, like all the good sides of that, you know what I mean? But I know
Yeah.
that that's not everybody's experience,
Yeah.
and that I would love to see that people could have that same experience of being able to be seen as equal, and being able to be respected, and having accommodations respected, and that it's not weird or bad, and that, like, we can be really successful, and kind of switching the view from, like, administering, or like, from switching the view from that providing accommodations for somebody,
Yeah.
it is a burden, as opposed to switching the perspective to, like, this is something that's going to make this person more successful, and
Yeah.
therefore the practice, or the institution as a whole, is going to be more successful, and
Yeah.
so, yeah, so I think that's it, just switching this perspective to just make it less taboo,
Yeah.
and more that, like, what is good for this person is good for the whole, and what's
Mm,
typically good
mm.
for the whole is good for this person as well. And so I think, yeah,
That-
just make, yeah.
That's great. That's great. Yeah. Like, do better. Which, don't get me wrong, it sounds like you're having an amazing experience, and but it may or may not be. Well, I can tell you, it's not a universal experience. It's not a universal experience. Even though folks are doing sometimes the best that they can, sometimes there's still some learning. There's still some learning to be done. So, and then my final question for you, Frank, is what advice would you give to an autistic person considering a career in veterinary medicine?
I will caveat my answer by saying anyone who asks me about a career in veterinary medicine, I try to poke holes in, because I think you have to do real due diligence about this as a career for a lot of reasons. And I think that you can love animals with all your heart and want to be a doctor and all that, but if you don't understand the realities of the business aspects of it, and finances, and people who don't have finances, how are they going to take care of, and what are you going to do with that emotional burden? There's a lot more in it than just understanding the biochemistry and the pathophysiology, right? So I try to I sum it up with folks like, if you can think of doing anything else, do that. If anything else would possibly make you happy, go do that. But if you can't let go of the idea of being a vet, and I couldn't, so I think that the thing to understand about vet med is it is changing, it is evolving, it is improving. We are based in science. We are based in evidence and research and publications, and all of those things support the direction we're going, as far as making accommodations,
Yeah.
as far as
Yeah.
understanding there are different types of communication. It's like it's funny. I talk to some older doctors like my age,
I feel you,
and
Frank. I feel you.
and they'll be like, the communications. I was like, if you've been a doctor for more than 5 minutes, when you walk into an exam room and you meet a new client, a new pet parent, you've got 30 seconds less actually to figure out where they're at to deliver the information you need to deliver. They can be human MDs and nurses. They can have no high school education, no knowledge of science whatsoever, or anywhere in between. But they're all there because they care about their pet and something's going on they need your help with. But you've got to find a way to reach them where they're at. So how do you do that? You have to change what you understand where they are and meet them there. Because if you come in with the same 6 sentences to talk about what you've got going on, you're going to miss 90% of the people, because you've got to tailor it. And I said it's the same thing looking at ASD. It's like there's different ways for us to be, and understanding that and respecting that is such a huge part of doing it. So I think it's, as part of the process, if a person was in pre-vet and they were looking to apply to vet schools, I'd say, hey, if you're at the point in the interview, or even if you go to open house or whatever, ask the questions. Ask the questions about accommodation. Ask the questions about how these things are handled. Is it done because it's the law and we do it grudgingly, or do they actually take an active role in trying to make the veterinary profession look more like the rest of the world? Because it doesn't in a lot of ways, right? So, I think we've got a lot of work to do, but I think there are a lot of great people who are trying to move that ball forward. As far as making us acknowledge that we're different. Not everybody's the same. Everybody's got something going on, and so, having respect for that, having understanding for it, making accommodations for it, that all should be like baseline humanity stuff. But we are where we are, right? So
We are where
yeah,
we are.
I just think asking the questions, asking the pointed questions about the things you would need to be successful in a program, ask them, get the answers, be fully aware of what you're getting into.
Great advice, especially since I'm sure we would all be very rich if we had a dime for every time we heard someone say that they wanted to go into vet med because they didn't like people. I'm like, yeah, but I tell people all the time, I have a dog, a cute little dog. I'm like, but he can't drive and he doesn't have his own Amex. So you're kind of reliant on me in this scenario. And I have questions and I expect you to talk to me and I expect you to tell me what's going on, right? And so there is this kind of misalignment of expectations sometimes where folks are like, I want to work with all the animals. It's like one of those memes is like, this is what you think I do. And you end up spending way more time talking to people versus the healing part. So a lot of the healing part is actually the talking part. So yeah, great advice. Great advice. Do your due diligence. So I have so enjoyed this conversation. Thank you so much for taking time, one, out of your schedule, two, for being able and willing to talk about your experiences in this format. Thank you so much for your time, and I'm just really appreciate it. And again, Megan, yeah, really, like I need a little bit of your optimism. Like thumbs up. I love it. So this has been another episode of AAVMC's On Air. Please be sure to like and subscribe the podcast on your favorite podcast app. And be sure to stick around on YouTube or on those podcast apps for the next episode. And with that, I will bid Megan and Frank again, thank you. And it's been really a pleasure. Thank you.
Thank you.
Thanks.